Every morning, millions of Americans over 60 do the exact same thing without thinking twice. They open a pill organizer, swallow what's inside, and move on with their day. It feels routine. It feels safe. It feels like something a doctor already approved, so there is nothing left to worry about. But here is a number worth sitting with for a moment. Nearly 9 out of 10 adults over 65 in this country are taking at least one prescription medication, and more than 2 out of 3 are taking 3 or more every single month. Somewhere inside that daily ritual, for a significant number of people, one of those pills is quietly working against them instead of for them. Not because the medication is bad, not because a doctor made a careless mistake, but because the body swallowing that pill today is not the same body that existed at 40 or even at 55. And almost nobody sits a person down and explains exactly how much that changes things. By the end of this video, you will know 7 warning signs that most people over 60 completely overlook, signs that often get written off as just getting older, when in reality, they can be the body's way of raising a hand and asking for help. Some of these involve medications sitting in almost every household in America right now. One involves a food many people eat for breakfast. Another involves a habit so common that most people would never even think to mention it to their doctor. Stay with me, because sign number 4 in particular catches even careful, health-conscious people off guard. Let's talk about why this even happens in the first place. As the body ages, the liver and kidneys, the 2 organs responsible for breaking down and clearing medication out of the bloodstream, slow down. Not dramatically, not overnight, but steadily, year after year. A dose that was processed efficiently at 45 can sit in the bloodstream far longer at 70, quietly building up rather than clearing out the way it used to. At the same time, the ratio of fat to muscle in the body shifts, which changes how certain drugs are absorbed and stored. The brain also becomes more sensitive to sedating medications, even at doses that once felt mild. Layer on top of that the fact that most people over 60 are not managing one health condition. They are managing 2, 3, sometimes 5 at once, each one often treated by a different specialist who may never speak to the others. A cardiologist prescribes one thing, a rheumatologist prescribes another. An eye doctor recommends something over the counter. Nobody in that chain is necessarily doing anything wrong, but nobody is looking at the full picture either. And that gap, that space between prescribers who never compare notes, is exactly where the danger tends to hide. Doctors have a name for this vulnerability. It's called age-related pharmacokinetic change, and researchers have found that adults over 65 are roughly twice as likely to experience an adverse reaction to medication compared to younger adults, with hospitalizations tied to medication problems occurring 4 to 7 times more often in this age group. That is not a small statistical footnote. That is a signal that the rules of medication safety genuinely change once you cross a certain age, and almost nobody explains that shift out loud. Think about how strange that actually is. We accept, without question, that a car needs different maintenance at 150,000 miles than it did brand new off the lot. Nobody argues about that. But when it comes to the human body, there's an unspoken assumption that if a medication worked fine at 50, it should keep working exactly the same way forever. The research simply does not support that assumption, and yet almost no one sits patients down for a dedicated conversation about it. It gets mentioned, if at all, in a rushed sentence at the tail end of an appointment that was already running behind schedule. That gap between what the research shows and what patients actually hear is exactly why this video exists. Not to scare you away from medication that is genuinely helping you. Prescription drugs, used correctly, add years and quality of life that previous generations never had access to. This is about something narrower and frankly more useful. Learning to recognize the specific patterns that tend to slip through the cracks, so that if one of them shows up in your own life, you catch it early instead of months or years down the line. So let's start where most people would least expect it. Warning sign number 7. Sign number 7 is reaching for an over-the-counter sleep aid or allergy medication more nights than not. Picture this. Sleep has gotten harder. Falling asleep takes longer, staying asleep feels impossible, and 3 a.m. has become an unwelcome regular visitor. So, a bottle of a nighttime sleep aid or an antihistamine originally meant for allergies becomes part of the nightly routine. It works. It knocks you out. It feels harmless because it sits on a regular pharmacy shelf. No prescription required. Here is what almost nobody explains at the pharmacy counter. Many of these products contain a compound called diphenhydramine, which belongs to a class of drugs known as anticholinergics. These medications block a chemical messenger in the brain called acetylcholine, which plays a central role in memory, alertness, and clear thinking. In a younger body, the effect is usually mild grogginess the next morning. In an older body, the effect can be far more pronounced, and the concern goes beyond a foggy morning. Multiple long-term studies, including a well-known study published in JAMA Internal Medicine that followed nearly 3,500 adults over age 65 for a decade, found that people with the highest cumulative use of strong anticholinergic medications had a meaningfully higher risk of developing dementia compared to those who rarely used them. Researchers are careful to point out that this shows an association, not definitive proof of cause and effect. But the pattern has shown up across multiple separate studies involving different populations using different methods, which is exactly the kind of repeated signal that makes scientists pay closer attention rather than dismiss it. In the short term, the more immediate danger is confusion and impaired balance, both of which raise the risk of a fall. And falls, as we'll come back to shortly, are one of the leading causes of serious injury in adults over 60. The fix here is not to panic or throw every bottle in the trash tonight. Occasional short-term use for a few nights during a bad allergy flare is a very different situation than reaching for it as a nightly habit month after month. If sleep has become a persistent struggle, that is worth bringing to a doctor directly, because there are non-anticholinergic alternatives, along with non-drug approaches to insomnia, that carry a much lower risk profile for someone over 60. There's also a simple label reading habit worth building here. Diphenhydramine hides under a lot of different brand names, tucked into nighttime cold medicine, combination allergy products, and even certain over-the-counter pain relievers marketed as PM formulas for nighttime use. Many people take one of these products without ever realizing it belongs to the same drug family as an allergy pill they already took earlier that day, effectively doubling their dose without knowing it. Checking the active ingredient list, not just the brand name on the front of the box, is a 2-minute habit that closes that gap completely. Newer, non-drowsy antihistamines like loratadine generally don't carry the same anticholinergic burden, and pharmacists are usually glad to point toward one when asked directly. Which brings us to a habit that feels even more harmless than a sleep aid. Warning sign number 6. Sign number 6 is taking ibuprofen or naproxen regularly for everyday aches without a doctor's guidance. A stiff knee in the morning, a sore lower back after gardening, nagging arthritis pain that flares up when the weather shifts. For most of adult life, the answer has been simple. Grab an over-the-counter pain reliever, take it, feel better, move on. It becomes such an automatic response that most people never think to mention it to a doctor at all, because in their mind, it isn't really medication. It's just something you take for a headache or a sore back. But this category of drugs, known as NSAIDs, behaves very differently in a body over 60. These medications work by blocking enzymes involved in inflammation, but those same enzymes also protect the stomach lining, help regulate blood pressure, and support healthy blood flow through the kidneys. Block them regularly, and researchers have found that older adults face a significantly higher risk of gastrointestinal bleeding, kidney strain, and even cardiovascular complications compared to younger users of the same medication at the same dose. One clinical review found that NSAIDs are responsible for roughly 30% of hospital admissions related to adverse drug reactions in older adults, primarily due to bleeding, cardiovascular events, and kidney damage. And the unsettling part is that gastrointestinal bleeding from NSAIDs frequently happens without any obvious warning signs beforehand. No stomach pain to alert you, no early symptom to catch it in time. Sometimes the first sign is unexplained fatigue or dizziness caused by silent blood loss. This does not mean NSAIDs are forbidden after 60. Occasional, short-term use for an acute issue is generally considered reasonable for most people. The real risk lies in daily or near-daily use for chronic pain without a doctor weighing in, especially for anyone also taking blood thinners, blood pressure medication, or diuretics, where the combination can compound the danger substantially. Research on hospital admissions has shown that certain combinations amplify the danger dramatically, with NSAIDs taken alongside corticosteroids raising bleeding risk many times over compared to taking either one alone, and similar amplification showing up with certain antidepressants. If chronic pain has become a daily companion, that conversation with a doctor is worth having, because safer, long-term alternatives often exist. Topical anti-inflammatory gels applied directly to a sore joint, for instance, deliver relief to the area that hurts while exposing the rest of the body, including the stomach and kidneys, to a fraction of the medication that an oral pill would send through the entire bloodstream. It's a small switch that can preserve nearly all of the benefit while meaningfully cutting the risk. Now for something that surprises almost everyone the first time they hear it. Warning sign number 5. Sign number 5 is enjoying grapefruit or grapefruit juice while taking certain heart or cholesterol medications. This sounds almost too strange to be true. A piece of fruit interacting with a prescription drug, but the science behind it is well documented, and the FDA has required warning labels on numerous medications, specifically because of it. Grapefruit contains natural compounds that block an enzyme in the intestinal wall called CYP3A4, an enzyme whose entire job is breaking down certain medications before they fully enter the bloodstream. When that enzyme gets blocked, medications that would normally be partially filtered out instead flood into the bloodstream at much higher concentrations than intended. For certain widely prescribed statins, researchers have found this can spike blood levels of the drug anywhere from 3 to as much as 15 times higher than normal, turning a carefully calibrated daily dose into something the body was never meant to handle at once. And here is the detail that makes this especially relevant after 60. This enzyme blocking effect is not temporary. It does not wear off after a few hours the way people might assume. The body has to build entirely new enzymes to restore normal processing, which can take a day or more. Combine that with the slower drug clearance that already comes with aging, and the interaction becomes more pronounced, not less, in exactly the population most likely to be taking these medications in the first place. This interaction is not limited to statins. Certain blood pressure medications, particular anti-anxiety medications, and some heart rhythm drugs carry the same warning. The safest approach is simple. Check the label or ask a pharmacist directly whether a specific medication carries a grapefruit warning, rather than assuming that a food this natural and healthy could not possibly cause a problem. Let's move to something that shows up in nearly every household with more than one chronic condition. Warning sign number 4. Sign number 4 is seeing several different doctors who have never actually compared notes on your full medication list. This is the one that catches even careful, organized people off guard, because on the surface, everything looks responsible. Regular checkups, specialists for each condition, prescriptions filled exactly as directed. Nothing about it feels reckless. But here is what tends to happen quietly in the background. A cardiologist adds a medication for blood pressure. Months later, a different provider prescribes something for pain or anxiety without necessarily seeing that full existing list. An eye doctor recommends an over-the-counter product for dry eyes, never thinking of it as something that could interact with anything. None of these individual decisions look wrong on their own, but layered together, they can create what pharmacists call a potentially inappropriate medication regimen, one where a combination that made sense years ago no longer reflects the safest option for the person taking it today. Researchers who study this describe it using a specific and somewhat unsettling term: cascading prescriptions. It's what happens when a side effect from one medication is mistaken for a brand new health problem, leading to a second prescription to treat a symptom that the first medication actually caused. Picture a blood pressure medication causing mild swelling in the ankles as a known side effect. A different provider, unaware of that connection, sees the swelling and prescribes a diuretic to treat it. The diuretic then depletes potassium, which shows up as fatigue and muscle cramping at a third appointment, which then gets treated as its own separate problem. 3 prescriptions later, the person is managing side effects of side effects when the actual fix might have been adjusting the very first medication. The American Geriatric Society maintains an entire published reference, updated roughly every 3 years, specifically listing medications and combinations that carry outsized risk for adults over 65, precisely because this pattern is so common and so easy to miss from any single provider's point of view. It's not a secret document. It's simply one that patients rarely hear about unless they happen to ask. The fix does not require confronting every doctor individually or feeling like a difficult patient. It starts with something far simpler, using one pharmacy whenever possible, because pharmacists have software specifically designed to flag dangerous interactions across an entire medication list, not just the prescriptions filled that day. And once a year, bringing every single medication, including over-the-counter products and supplements, into one appointment for what's often called a full medication review. It's a conversation worth having proactively rather than waiting for a problem to force it. Now for a warning sign that gets dismissed more than almost any other. Warning sign number 3. Sign number 3 is a new bout of dizziness, unsteadiness, or a fall that gets chalked up to simply getting older. This one deserves extra attention because of how often it gets waved away. Someone stands up a little too fast and the room tilts for a second, or a trip on the stairs that never used to happen suddenly happens twice in 1 month. The instinct for both the person experiencing it and sometimes even family members is to assume this is just what aging looks like. Balance isn't what it used to be. That's normal, right? Sometimes it genuinely is age-related. But dizziness and falls are also 2 of the most well-documented side effects of a wide range of medications commonly prescribed after 60, including blood pressure drugs, sedatives, certain antidepressants, and anything with sedating or anticholinergic properties. When several of these medications are combined, a phenomenon researchers call oversedation, drowsiness, and impaired coordination can build to a level that significantly increases the risk of a serious fall. This matters because falls are not a minor inconvenience in this age group. They are one of the leading causes of injury-related hospitalization for adults over 65 in the United States, and a single bad fall can trigger a cascade of complications that extends far beyond the initial injury, from a hip fracture to a lengthy hospital stay to a real loss of independence afterward. Yet because dizziness feels vague and falls can have many causes, medication is often the last explanation anyone considers rather than the first. There's a useful test some geriatric specialists recommend, sometimes called a brown bag review. Every medication and supplement in the house, prescription and over-the-counter alike, gets placed in a bag and brought to a single appointment, timed against a log of when dizziness or unsteadiness tends to happen during the day. Patterns that seem random in the moment, like feeling foggy every afternoon or unsteady specifically after standing up quickly, often line up neatly with when a particular medication peaks in the bloodstream. That kind of side-by-side comparison is something a rushed phone consultation can almost never catch, but a focused, dedicated appointment usually can. The lesson here is not to panic over a single moment of lightheadedness. It's to stop automatically filing every new episode of dizziness or every new fall under the heading of getting older without at least asking the question out loud. A simple conversation walking a doctor through every medication and every recent symptom side by side can reveal a pattern that might otherwise take months to notice. We're getting close now. Warning sign number 2. Sign number 2 is adjusting your own dose, skipping doses to make a prescription last longer, or stopping a medication without telling your doctor. This one rarely comes from carelessness. It usually comes from a completely understandable place. Maybe a medication is expensive, and stretching it a little further feels like the only option. Maybe a side effect feels unpleasant, so cutting the dose in half feels like a reasonable compromise. Maybe a symptom improved, so continuing to take something for a problem that seems to have resolved feels unnecessary. But certain medications, particularly those affecting blood pressure, blood sugar, heart rhythm, and mood, are calibrated specifically around consistency. Stopping certain blood pressure medications abruptly, for example, can trigger a rebound effect, where blood pressure spikes higher than it was before treatment even started. Certain other medications carry withdrawal-like effects when stopped suddenly, ranging from uncomfortable to genuinely dangerous, depending on the specific drug and the person's overall health. If cost is the barrier, that is a conversation worth having directly with a doctor or pharmacist, because generic alternatives, manufacturer assistance programs, or a different medication within the same drug class often exist and frequently go unmentioned unless specifically asked about. If a side effect feels unbearable, that too is worth reporting rather than quietly working around, because there is very often another option that treats the same condition with a gentler side effect profile. The theme running through nearly every one of these 7 warning signs is the same. Silence, even well-intentioned silence, is often the most dangerous variable in the entire equation. And now, warning sign number 1, the one that ties everything else together. Sign number 1 is assuming that anything sold without a prescription must be automatically safe to combine with everything else you're taking. This is the quiet root underneath nearly every warning sign we've covered. Supplements, herbal remedies, vitamins, over-the-counter pain relievers, sleep aids, allergy medication. None of it requires a prescription, so none of it feels like real medication. And because of that framing, it often never even gets mentioned during a doctor's visit. But researchers have found that fewer than half of older adults who use herbal supplements or complementary remedies actually mention it to their healthcare provider. Meanwhile, the FDA does not evaluate over-the-counter supplements with anywhere near the same rigor as prescription medications, meaning there is often limited reliable information available on how a given herbal product might interact with a prescribed drug. Something as seemingly benign as St. John's wort, commonly used for mood support, is known to interfere with the effectiveness of a wide range of prescription medications, including certain heart medications and blood thinners. Even common vitamin supplements taken in high doses can interact with blood-thinning medications in ways that catch both patients and sometimes even providers off guard. The habit worth building is a simple one. Every single product that enters the body, whether it came from a pharmacy counter, a health food store, or a kitchen cabinet, belongs on the same list, discussed at the same appointment. Nothing needs to be hidden or minimized because it wasn't technically prescribed. The goal is not suspicion of every supplement or every over-the-counter product. The goal is full visibility, because the only person positioned to catch a dangerous combination is someone who can see the entire picture at once. So here's where that leaves us. None of these 7 warning signs are really about fear. They're about information that should have been handed over at some point, but rarely is, because a rushed 15-minute appointment rarely leaves room for a conversation this detailed. The body changes after 60 in ways that genuinely shift how it handles medication, and that shift deserves to be treated as useful knowledge, not as an alarming secret. If any of these 7 signs sounded familiar, whether it's a nightly allergy pill, a daily dose of ibuprofen, a grapefruit habit, several specialists who've never spoken to each other, dizziness written off as aging, a dose quietly adjusted at home, or a supplement never mentioned out loud, the next step is refreshingly simple. Not fear, not throwing anything away tonight, just one honest conversation, bringing every single thing you take, prescribed or not, into a single appointment and asking a direct question. Does everything on this list still make sense together for the body I actually have today? That single conversation, more than any app, any pill organizer, or any warning label, is what actually protects people through the decades ahead. If this helped you see something you hadn't considered before, do me a favor and hit like, because it genuinely helps this information reach more people who need to hear it. Subscribe if you want more videos like this one, breaking down what the research actually says in plain, honest language. And if there's someone in your life over 60, a parent, a spouse, a neighbor, who this made you think of, share it with them today rather than later. And I'd love to know in the comments which of these 7 surprised you the most. I read every single one, and I'll see you in the next video.